Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers here present, the Leader of Labor, Directors General, ladies and gentlemen of the press. Again, what I will say will reinforce much of what the Secretary to the Government has already put down. And as of today, 24th of April 2020, 981 people in 25 states of the Federation and the Federal Capital Territory have been confirmed to have COVID-19 infection. The 108 additional confirmations are as follows: 78 in Lagos, 14 in the Federal Capital Territory, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, and 1 each in Kwara and Plateau. 197 persons have been successfully treated for COVID-19 and discharged home, while 31 deaths have sadly been recorded. Again, the high number of new cases is due to ongoing community transmission and also the very active and accelerated case search going on. From our test statistics, the most affected age group among the positives is the age group between 31 and 40 years, while the highest COVID-19 fatality rate is among the older generation above 50 years of age. We have now deployed COVID-19 starter packs to all tertiary health institutions and federal medical centers to complement what was earlier sent to each state. The starter packs consist of medical consumables and disposables to ensure that our frontline healthcare workers are protected, and also that there is synergy and collaboration between federal tertiary institutions and the host state health network. The COVID-19 capable National Laboratory Network, led by NCDC, has capacity to test over 1,500 samples per day in at least 13 laboratories, but the present utilization rate is barely 50%, since we averagely test about 600 samples per day, being the samples received at the centers. Efforts are on to increase the number of functional laboratories in the country. However, we need to meanwhile improve surveillance, sample collection strategy, and transport logistics to laboratories, and also reduce the turnaround time for tests. In our strategy, testing positive is followed by isolation and treatment as needed. Those who require no treatment still need to be in isolation in the interest of the public and their household. We urge all persons who have tested positive to comply, and for citizens to remember that anyone who has tested positive is not only just a private patient, but a patient of general interest. The COVID-19 virus has long since been declared a public health emergency of international concern. I wish to use this opportunity to applaud our frontline health workers again in the COVID-19 pandemic. Salute your courage and patriotism, but I urge you to protect yourselves as prescribed and use your personal protective equipment judiciously. Do not attempt to treat COVID-19 patients without using adequate PPE, or if your institution is not accredited to do so. This is important because we need to keep health workers safe at such a time and cannot afford the numbers who test positive to COVID-19 and have to go into isolation. Remain vigilant in the line of duty and maintain a high index of suspicion for this infection. I wish to appeal to all citizens to take the advisories that we give here daily and also repeat every time. Take these advisories seriously and adhere to the hand and respiratory hygiene as well as the social distancing directives. The use of a cloth mask or face covering when you leave your residence is recommended, as is the injunction to avoid mass gatherings and non-essential travels. I wish to restate the advisory given yesterday to reduce risk of community transmission by reducing all non-essential travel, especially long-distance travel. This will help to reduce the risk of carrying the virus from one state to the other. Today, we want to join the rest of the world to commemorate World Immunization Day, World Immunization Week. The theme for this year is Vaccines Work for All, and is dedicated to promoting the use of vaccines to protect people of all ages against diseases and death. While waiting for the vaccine for COVID-19, let us collectively adhere to all public health advisories. Finally, I emphasize again that to defeat the spread of COVID-19 requires collective and individual efforts. If you suspect you have been exposed to COVID-19 or anyone around you has been, call the toll-free NCDC numbers and the emergency number of 112 and 0800 97000010. Resources and real-time information on COVID-19 can be found in the social media handles of Federal Ministry of Health and the NCDC, the Federal Ministry of Health website, and NCDC microsite. Please stay home, stay safe, take care of yourself, take care of your family, take precautions.